My name is Chandler Bateman. This is COMM 210-820. Here is my audience. Okay. And I chose to do my presentation on poverty. According to the book Bridges Out of Poverty, this is the working definition of poverty. The extent to which an individual does without resources. So this is financial, emotional, mental, spiritual, physical, support systems, relationships, role models, knowledge of hidden rules or coping strategies. It's extremely important to know this definition because there's a lot of misconceptions as to what poverty is. Some key points to hit before we begin. Poverty is relative. So this means that if everyone around you has a similar circumstance, then the notion of poverty and wealth is vague. Poverty or wealth only exists in relationships to known quantities or expectations. Poverty occurs in all races and all countries. The notion of the middle class is actually a new thing to the 20th and 21st century. The population that is poor is subject to definition and circumstance. Economic class is a continuous, not clear-cut distinction. In 2004, the poverty line for a family of four was considered $18,850 in the U.S. According to the census data from 2003, the median household income was $43,318, and only 15% of U.S. households earned more than $100,000 a year. Generational poverty and situational poverty are different. We'll come back to these later. An individual brings their hidden rules or of their class and from in which they were raised. So even though an income for an individual might rise significantly, patterns of thought, behavior, or social interaction may be carried with them. These are called hidden rules, which will show up a couple more times in the presentation. They exist in all social classes and are unspoken understanding that cue the members of the group that this individual does not fit in. Dress, food, decor, vehicle, anything like that. Poverty is a problem. Lack of financial support for basic goods and services is the main point. This could be food, clothing, school supplies, home furnishings, education, or healthcare. Emotionally unstable, unable to control responses in negative situations, so this could be self-destructive behavior, low stamina, lack of perseverance, or making poor choices in life. Lack of mental capacity to perform acquired skills in daily life, so reading, writing, computing, professional skills or communication skills. Lack of resources or connections among others. So this could mean if you're surrounded by a group of other people in poverty, this could lead to a stagnant lifestyle or a low goal setting. Lack of knowledge of the hidden rules. As discussed earlier, this could be what to say, how to act, what to wear, or what's socially acceptable. Unable to cope through tough situations or issues that are not permanent, so thinking that you are stuck in a situation permanently. How poverty affects a society. We as a community should do what we can to help out our fellow man because it does involve everybody in our community. Children in poverty are in our schools and affected by the mental barrier, so this could be illiteracy or reading, writing, communication skills, or social skills that they might be hindered by for the rest of their lives. Unemployment could lead to hunger and eventually death. Sometimes when a person's unemployed due to a kink in the system or loopholes, they might not be able to obtain government help. Therefore, they may not be able to get food stamps or access to food programs that could help their family eat. People in poverty are more likely to get sick or contract disease because of the lack of doctors in the area, lack of access to health insurance, or their environments that may cause them to obtain sickness or disease. Society discriminates against people in poverty due to a lack of understanding, so this could be stereotypes that they are poor, lazy, stupid. Poverty affecting health. Little to no access to health insurance benefits. Very few doctors in the surrounding areas. Poor living conditions causing sickness. Low education of safe sex causing the spread of STDs. Small amount of money to spend on fast food, which are quick and easy and cheap. working hard for low pay and no benefits. So in job loss or low-income jobs that might prevent healthcare benefits, basic benefits like vision, dental, and medical may not be available. In low-income neighborhoods, there also might be a transportation issue. They might have to take the bus everywhere, therefore not being able to go to grocery stores. They might have to go to convenience stores, which are more likely located in low-income neighborhoods, which may lead to high calories and low nutrients, which could lead to obesity. Okay, stereotypes of the poor. According to the Washington Post, these are the most common stereotypes of the poor: that they are lazy, on drugs, alcoholics, don't value their education, stupid, or bad parents. And according to the article Framing the Poor, Media Coverage, and the U.S. Poverty Policy, ideas of the poor are simply growing in pessimism. The difference between generational and situational poverty, as mentioned earlier, as generational poverty is defined by being in poverty for 2 generations or longer. Situational poverty is a shorter time and caused by circumstance, so death, illness, or divorce. Generational poverty is harder to get out of, but situational poverty is more detrimental because it is a sudden loss of resources to the individual. Poverty affects children due to behavioral issues at home or school, social problems with peer groups, distrust in adults, violence or anger issues, low test scores or grades, and health issues. Solution to poverty on an individual level is changing our views of the poor, supporting our local organizations, and donating our time and understanding. On a national level, according to the Center for American Progress, Obama proposed creating new jobs, training programs for new positions, raising wages, quality education for youth, and forgiving the national debt. Breaking the cycle is the solution to poverty. The most important way we can begin is to understand the stereotypes and break them down, donating our time and our funds. And just in Muncie, these are some of the local organizations. I currently work for Teamwork for Quality Living, which teaches the poor ways out and provides children enrichment and a hot meal. And that is my presentation. And here is my audience that is still here. And my sources are listed on the final slide.